We have startling new information in the battle against the opioid epidemic. A newly released report says the Food and Drug Administration may have failed to set strict enough standards and follow through for training doctors about the risks associated with the highly addictive drugs. Researchers say a lack of oversight and training problems happened while the opioid crisis killed tens of thousands of people a year. Our consumer investigative correspondent, Anna Werner, is here. Anna, what exactly are these rules and how were they supposed to work?
Well, good morning, Jerika. Those rules, part of an FDA process. It's called a Risk Evaluation and Mitigation Strategy, or REMS. It required manufacturers of long-acting addictive opioids like OxyContin to pay for training for doctors prescribing those drugs, then to monitor and report back on how well that training was working. But in the new study, researchers found that didn't happen.
It basically controlled my life.
Jennifer Wysong became addicted to opioids after having a C-section, an addiction that eventually landed her behind bars.
Every single day when I woke up, my main focus was wake up and figure out a way to get what I needed to just get through the day. I didn't care who I hurt or, what I had to do to get it.
Her story is not uncommon. The Centers for Disease Control and Prevention says in 2017, opioids were involved in more than 65% of all drug overdose deaths. The report says long-acting or extended-release opioids such as oxycodone and morphine were associated with greater risk of addiction, unintentional overdose, and death than their immediate-release counterparts. So in 2012, the FDA set up rules requiring painkiller manufacturers to deliver continuing education to doctors and develop medication guides to inform patients about risks, as well as monitor and report on patient access to drugs and safety. But the problem, says some experts, was that the FDA let the pharmaceutical companies themselves create the curriculum. Dr. Andrew Kolodny is medical director for opioid policy research at Brandeis University.
One of the problems is that the education is voluntary. The other problem was simply the content. It was a curriculum designed by the drug makers, a curriculum that didn't really discourage aggressive prescribing.
Researchers at Johns Hopkins University found in their review of thousands of FDA documents that the agency failed to follow up on problems with the program and never insisted on changes to address those problems.
So what do you think were the consequences of this?
So the consequences were that at a time when the CDC and other public health groups across the country were trying to get doctors to prescribe more cautiously, the FDA had a training program for doctors that was encouraging more aggressive prescribing. This was making it more difficult to tackle the opioid crisis.
In a statement to CBS News, the FDA says the opioid tragedy is a defining public health crisis, and the REMS program is one element in a broader national effort to stem the tide of addiction in communities. Jennifer Wysong is now clean and sober, but wonders if that training program could have made a difference.
If they could know what we know now, back then, things might have been a little bit different.
The CDC does lay out guidelines for proper opioid prescription. Those include evaluating the need for pain medications, proper selection of the right drug, and accessing the risk or explaining the risk of addiction, explaining those risks to the patient. But it wasn't until 2017 that the FDA began requiring safety programs for all opioid painkillers and not just these long-acting ones they looked at here.
So, Anna, in the piece you talk about the pharmaceutical companies writing the curriculum for the doctors? Why is the FDA allowing that?
That's what Dr. Kolodny said. The FDA didn't respond to questions about that, but he basically believes that the influence of manufacturers played a part here, that they didn't want to lose sales. And, that's his opinion, obviously, as an expert, and the researchers seem to comment on that as well.
Certainly hoping the FDA does better oversight there. Thank you, Anna.